Do you always take people down the medication route, or do you also offer the coaching, or do you feel like it could be combined?
Yeah, so I think it's horses for courses, right? So it's a tailored treatment. So I will always mention, because medication is first line recommended treatment and it's so powerful, I will mention medication. If someone, I normally will not just mention medication alone unless that's someone's preference.
Yeah.
I think it needs to be combined in conjunction with ADHD coaching in an ideal world. And the research is showing if you combine the two, you're getting better results, which is not really surprising. We have that old sort of adage, pills don't create skills, right?
Yeah.
And that's true. So your medication is going to help you to a certain extent, but you've had a lifelong history of learning to do things in a certain way. And some of it needs to be not unlearned, but tweaked.
Yeah.
Yeah. And that's where coaching comes in. And so in an ideal world, I'd like clients to do both.
Yeah.
What they might sometimes do is they'll try medication first, and they'll say, well, I'll see with what I'm left with at the end.
Yeah.
And then go down the coaching route to try.
See, I sometimes have the opposite where people will say, I want to try the coaching first and let me just see if I'm able to manage some of these symptoms, because they didn't know about the symptoms. And like you said, it's trying to tailor to everyone. So people will have...
And that's absolutely fine.
Yeah.
And I understand the logic behind that. If you've never been on medication in your life, medication can be quite scary.
Yeah.
Right?
Yeah.
So you might think, you know what, I actually want to see if I can learn skills to manage this.
Yeah.
And then see where I'm at in the end after that.
Yeah.
Which is totally
and learning
fine.
like coping skills, but healthy ones, not unhealthy strategies. Because often you see people using like alcohol to help them cope with social anxiety, or you might find them overworking in order to like manage and just stop their mind from wandering by doing other things.
Absolutely.
So there's lots of ways. Everyone shows up very differently with ADHD. And I think once you get a diagnosis, it's not just saying, okay, I have ADHD, it's understanding it now.
Absolutely.
And diving deeper into making sense of how it shows up.
Absolutely, yeah.
Yeah.